We've talked a lot about doctors and nurses in the front lines of this battle against coronavirus. The Connecticut Nurses Association represents 65,000 licensed nurses across our state. And tonight we're talking with the organization's executive director. She is Kimberly Sandor. And Kimberly, great to see you here with us tonight.
Thank you so much.
First of all, I want to say I was talking to a friend of mine who's a nurse last week, and he never complained, said that they love doing this job. They realize it's tough, but it's work that has to be done. So let's begin by just talking about how COVID-19 is impacting nurses on the job. What can you share with us?
Well, the Connecticut Nurses Association represents all registered nurses across the state in all specialty areas and all practice settings. And we are hearing from them through their stories and surveys we've done. They have a lot of concerns about PPE. I think personal protective equipment is something that all of us are learning in our vocabulary these days. And the nurses are talking about it.
Kimberly, are there nurses out there working in hospitals in Connecticut right now who do not have PPE?
We don't hear that nurses don't have them. Because we represent all nurses across the state in all settings, we are working with the governor, and we have daily meetings with the Hospital Association, other long-term care, the Medical Society, to have conversations to make sure nurses' voices are elevated. There is PPE. Nurses, healthcare workers all need adequate PPE. The problem is there's been a dramatic shift in the way PPE is used because of the sheer number of people that are infected with the virus and a problem with the supply chain, to be quite frank about it, that everyone is optimizing the use of PPE.
Kimberly, how are these donations playing into the whole story here? Are there enough of them in terms of mask donations and food donations?
Mass donation, we continue to have the call out from EMS, fire, long-term care, home care. Everybody needs PPE. So if you have it, please bring it on down. PPE makes a world of difference and allows nurses to do their job and all healthcare workers to do their job without fear of bringing home the virus to their families and their loved ones.
We always see the big city hospitals getting donations of food and things like that. Are there any hospitals around the state in smaller towns that maybe aren't getting the kind of donations that you feel that they should?
Nurses are amazing. In the middle of all of this, I mean, they have shown the utmost gratitude and thankfulness. I love your sharing the love theme there, because all this stuff really makes a huge difference. The lawn signs thanking folks for being the work they're doing, the food donations. After a long shift, not being able to take off your PPE, just having a nice warm meal and something nice to eat, it really goes a long way and makes the hard work that they're doing feel a little bit better.
Well, we thank all of you for your service tonight. Kimberly Sandor, thank you so much. On behalf of all the nurses, thanks for all you're doing out there.
Thanks so much for having me.